in Nephi, or in Ephraim and in Richfield, there should be 2 mannequins with female and 2 mannequins with male. And I need you guys to practice both, because you never know which scenario you're going to get. And you never know in real life, oh, sorry, I've only passed this off on a female. I can't do you. So I'm going to show you on a female because it's harder than the male. On the male, you would do things a little bit different, and I'll kind of talk you through that as we go. So the first thing that you're going to do is you're going to wash your hands, and I'm going to use the... Okay, so you're going to wash your hands. You are going to assess why the patient has to have a catheter in the first place. Why is that important? Because you need to know why the patient's getting a catheter. Is it because they can't move? Are they immobile? Is it because they're getting ready to go to surgery? Is it because they're incontinent? Why is the reason for the patient getting the catheter? You need to know why you're doing what you're doing. Then you need to assess if they need help. Meaning, if they're a small child and you will not be able to maintain sterility, trying to hold them, and you're going to need help. If you have a large patient that you can't keep the legs lifted up on, or you can't get in there, you're going to need help with somebody with sterile gloves. If they've had a fracture, like if they have a fractured hip, you will not be able to hold that hip and move it as you would with a normal patient. You're going to need help holding the different areas, okay? So those are things that you're going to need to assess before. And then you're going to, like I said, wash your hands. You're going to identify the patient, and you're going to have him tell you, you know, your name. Hi, Mr. Jones, how are you today? I'm your nurse, Jennifer. And we're going to put a catheter in because you're having difficulty urinating. So what's your birthday? So he'll tell you his birthday. He'll tell you he doesn't want a catheter. And you'll tell him that the doctor's ordered it. So you're going to explain that you're going to have to lift his legs up and get him in, or her legs up and get him in a position. And that it'll be kind of cold for a second and a little bit uncomfortable. So you get a blanket, which is right here. And I usually blanket the part that we're not going to be touching, which is usually up here, so that they can stay a little bit warm. Okay? And then you need to... Gross, there's like a dead bug there or something. Okay. Then you need to...
Should name in the best duties.
Expose her area and help her into a comfortable position. And there's nothing comfortable about this position. It's awful and it's embarrassing, so be as quick as you can. I brought in a chucks and extra gloves, and we're going to perform pericare on her. So I'm going to put this chucks. I'm going to put my handy dandy gloves on. Okay, then I'm going to put the chucks underneath her. Then I'm going to perform pericare. I'm going to provide privacy because this isn't Utah Valley. No, just kidding. I hope nobody works there. And just let her know what you're doing. We're just cleaning you up really good down here so that you don't get an infection from your catheter. So, you're not passing off this part. You just have to pass off that you did do pericare. Okay. So then after you get pericare done, then you're going to open up your box. So you open your box up. You guys can see your box. And it needs to be 12 or 14 is normal French for catheters. That's what normal is. All right, so you open up your box. That's going to be my garbage. Okay, and you're going to have to do this sterilely. So you open side. You're actually supposed to.
You know they can't see you.
We can't see what you're doing, Jennifer. The camera doesn't show you.
Oh, that's why I moved over here to video.
I don't know how. Okay, what I'll do is I'll show you how to set up this part right here, and then I'm going to have to move around. How do I do this?
Put your back to the table or to the bed. There you go.
Like this? Okay.
You be quiet.
I'm sorry.
Not you. She's telling me, go over there. Go.
Okay, so this is how you set this up. So you go side, side, away from you, and then towards you. Always picking just the corners. Your gloves will be directly on the top. So you will get your gloves. And can you set your gloves on here?
Yes.
Be careful with touching it.
If you're careful with touching it, you can. But for this purpose, because you guys can see me, I'm going to. Well,
But you
I'm not.
If your
Just
hand's not sterile, you can't put it back.
okay. So I'll just set it here. You guys know how to put sterile gloves on. Okay. Then you put your sterile gloves on.
Move faster than it doesn't squeak if you move faster.
I need to work on that for this one.
So do I.
Okay, you got your sterile gloves on. Now, this is so hard because I'll just show both. Can you guys still see the patient in Richfield if I do this? Yes? Okay, the next thing is the drape. This is a sterile drape. So you take your sterile drape. You wrap the corners up in your gloves like this. Like this. So you roll it up kind of like this. So you have your sterile drape. You roll it up like this. And then you're going to put it right underneath the patient. But you're going to do that without touching your patient or the gloves on anything, so you're still sterile. Your next thing you guys have in here is another sterile drape, your second sterile drape. This one looks like this. So that diamond piece is going to go right over the perineum, like this. Making sure you're not touching your patient. Okay. Then you've got the 3 swab sticks. You know what I'm going to have to do so that you guys can see this.
Just position this so you're still towards the camera.
Could you think?
Like this.
Okay.
And then you can just
Can you
move
guys
from
still?
here to there.
Can you guys? Oh, they can't see.
Can you zoom out a little bit?
Sorry, you guys. This is hard to show
Or,
like this.
Like, turn it this way just a little bit.
Yeah, because you've got a lot of space over here if you can turn it.
Good.
Okay.
Oh, good.
And then
Okay.
turn it a little bit because you have a lot of space on the one corner.
And I realize you guys are going to be doing this a little
Yeah,
bit different
that's
because
better.
the way I'm positioned is